on, so now I have to, so I have two systems on. Okay, can everybody hear me?
Make sure your phone is muted too.
I have to,
Yes, yes.
okay, I had to lower my volume so we don't get an echo. Let me lower the other one. Okay, and CJ, I see CJ, but can we give you the recording afterwards, CJ? You asked to record. What he's,
I approved it, Laquita, because I think it was IA. Yeah.
oh, okay, so they approved it, CJ. I think that's Chris. Okay, now let me find my agenda. Okay, I'm just. Oh, yes, you can sit over there.
Edwin is the co-chair too? Okay. Laquita, you and Edwin are the co-hosts.
Okay, okay. Thank you, user. Okay, we're calling the meeting to order at 6:40. Thank you, everyone, for your patience. There's always the technical aspect of getting set up. And most of you are online, so we truly, truly appreciate that. And we have a very important discussion coming up with Dr. Elijah J. Williams, and who is Vice Dean of Columbia University's in Irving Medical Center. What do I have to do? Oh, I can get the volume lower. I couldn't get the volume lower. Irving Medical Center. He's Vice Dean of the Medical School, Community Health. And Sandra Harris, who is Vice President of Columbia University Irving Medical Center's Office of Public and Community Affairs. This is going to be a very important discussion, and we want all of you to stick around and be involved, as you generally do, but we really need you to be involved with us in this discussion about what is going on in the nation and how it impacts our district, and how we need to make sure our community residents are informed and know what to do to the best of our ability to tell them. We will probably have some availability of this discussion going forward, because we want to meet, talk to as many people as possible. And there may very well be a part two, as things are unfolding so quickly. And the chaos is still very real, but we're uncertain as to the results of that chaos. So may I, Heather, will you give us a motion to accept the agenda, but I have a couple of corrections on the agenda. I have Deborah Levine as a WHDC grantee in the initial agenda that went out. I was doing cut and paste and forgot to take out that part, but Deborah heads up the well, we'll introduce her. I don't have that right in front of me. It should be right on the agenda. But with the School of Public Health, she's a very important community partner to us. They have letters of support, and she'll be talking about program concept where they want our letter of support. So I needed to make that correction. I think that is it. Heather, can you
Motion to
accept?
Yeah.
Okay, thank you. And we'll move forward. We do not have a quorum right now. And there were emergencies on the part of two of our 6 committee members, and the other 2 may come join us a little bit later. We have about 16, 17 of you on Zoom with us. And we have, of course, as I mentioned earlier, Dr. Williams and Ms. Harris here at the office with us. Okay, let's see, Cheyenne, my friend Cheyenne is with the Department of Health. And Cheyenne, I'm just gonna call on you. Let's see, I don't know, I don't think Pauline is here, but you have so many important things that are going on. And I want you to tell us quickly about some of the recent announcements you said. As you can probably tell, I emailed out to a lot of people and forwarded the activities, but just tell us in your own words what's coming up.
Of course, happy to do that. Good evening, everyone. I'm Cheyenne Murillo from the Harlem Bureau of Neighborhood Health. And yes, I can definitely speak to some of the things happening at the Bureau of Neighborhood Health and also some of the things that I've sent out. I'll start with the Know Your Rights training happening next week. Oh no, happening tomorrow at 4 p.m. They're going to cover immigration updates as well as cover the executive orders, as well as your rights if you encounter ICE in public and private spaces, which is really important amid the changes of what constitutes a private space versus public, as well as other tips and helpful information, of course. I can put the link to register in the chat right now. This presentation, unfortunately, is only in English, and there will be no translation provided at the presentation. And this is also, I should mention, not through the Department of Health. This is just a partner who has requested that we share this information out. So it's through the Arthur Ashe Institute, along with Make the Road New York. And it is virtual. I don't think I mentioned that. So that's something I sent out recently. And then as far as the Bureau, we continue to provide PPE test kits. Although if you need test kits, we are out, but I have a really great resource through another bureau in the Department of Health, wherein you can request a bulk amount of test kits, any number really, and they'll fulfill what they can. I've seen requests for 1,000 kits, 500, 200, whatever you can house at your organization. And for that request, I'll put my information in the chat and you can email me if you are in need of bulk amounts of test kits. I'll also, if I can put in the chat, I'll put our one pager and calendar of events. I don't want to take up too much time, but I also put my information in the chat and I'm always a community resource for you. If you have any questions, something I didn't mention, I'm happy to answer it as well.
Thank you, Cheyenne. Any questions relative to what Cheyenne just talked about or Department of Health? Okay, so moving forward, our minutes were approved, but we can we'll formally do that with when a quorum comes. So I'll leave that. And let's just go down to Anthony Michael. And I see that you are here, Michael. I was trying to make you a co-host. So I'm gonna have to go to the other computer to do that. Okay, Michael, Anthony, you are a co-host. So if you have charts and graphs, while he is setting up, is there any other West Harlem Development Corporation representative who is a grantee and would like to say something? Because I left that space open because I thought there was someone who had made a request of us and I had forgotten, and so I wanted to just leave that space open. So if there is one present, great. If not, we'll of course move forward. So, Anthony, you can correct us if it's Anthony or Michael.
You can call me
And
anything you want.
which is the last name?
My last name is Michael.
Okay. Welcome and thank you and congratulations on being a West Harlem Development Corporation grant recipient.
Thank you.
Okay.
Thank you for having me here. Just have a quick presentation on our program and the background of our organization, since I think many of you are not familiar with us. As you can see from our background, we are a New York nonprofit. We are based on entirely volunteers, and we serve mostly the New York City, Rockland County, and New Jersey areas. We were formed on February 2021. We've received the following grants: the Community Care Corps, which comes out of the Department of Health and Human Services, which targets senior services. And this is in particular to their mental health, loneliness, and coming out of social isolation from COVID, which our project is based on that federal grant. We also received 2 grants from the New York State Department of Agriculture, which we created 2 food pantries out of Rockland County in Queens, and we were accepted in the Regional Food Bank in 2024. We are the first time West Harlem Development Corporation grant members from last year. We've expanded our volunteer services, and other universities are coming on to us, sending their students. Rutgers University has recently accepted us onto their initial pilot program, where they're paying their college students $5,000 as a stipend to work on our senior programs and our food pantry programs. New York University is currently in discussion with us on working with us on our senior programs and having their student clubs to assist in the New York City area. And Seton Hall Law School is working with us and has sent us a couple of law students to help create a legal seminar series for seniors. The collaborations that we have formed so far, we are working obviously with the National Community Care Corps. We work with the NYPD 26th Precinct in particular, especially in the West Harlem area, Morningside Retirement Health and Retirement Health Services. We also were introduced by the NYPD recently with the Community Assisted Tenant Control Housing Corps, and we've been working with them as well. Columbia Community Service assists us in giving out some of the in-kind products that we receive from corporations and to be distributed evenly within the West Harlem area. And of course, the New York State Department of Agriculture assists us as well. Just to summarize this, what we've seen so far is, based on our research and what of our grant proposals, increased risk of poverty also increases depression and loneliness. And that's what we're also trying to combat. We're ideally combating senior isolation, especially coming out of COVID. And with the increased prices in food, it also causes a lot of issues as well of depression within the senior community. As the recipient of the Community Care Corps, we've been working on, we've discussed with the 26th Precinct, the Morningside Retirement and Health Services since 2023, helping seniors combat social isolation. Some of our projects include taking them out to certain day trips. Some of these day trips you'll see later in this presentation, but they visit new places, they make new friends. One thing that we have now established is we're combining different residential places like Catch and Morningside Retirement, and people are making friends from different buildings at this time in this area. We also provide technology training on iPads. Some of our grant funds have allowed us to distribute iPads to certain areas too, and we're discussing that with Catch right now at the same time. Another added part of our project is we actually have seniors actively volunteer in their local community projects. So one thing that you'll see later as well is our annual backpack distribution in West Harlem. We have seniors in New York pack the backpacks, gather them, and get them ready for distribution for the NYPD in the West Harlem area. They also help wrap presents for the toy drive that the NYPD does as well. We find those types of activities worthwhile because they feel that they're meaningfully contributing to the local community and not just taking. We host monthly events with Morningside Retirement and Health Systems, and we're expanding that into the Catch. And we also have our annual Thanksgiving holiday parties and summer events throughout the year. We have a food distribution program that we deliver food to seniors, and it's distributed through the NYPD 26th precinct on certain special events. And we're attempting to expand that program in the near future. Like we discussed, it opened up in 2023. So far, we served over 200 West Harlem seniors between our monthly programs and our social events. Our staff is mostly made up of 30 volunteers, and we've established a new presence in West Harlem with the Catch organization. Our annual events are pretty active with the help of the NYPD. We've averaged about 100 seniors during this lonely time of the year with Thanksgiving and the holidays coming about. We also, our first trip occurred in April of 2024, where they went to the where they went to the Princeton, New Jersey Hindu temple. We sponsored the bus, and they went, and we subsidized the trip for them. Our monthly gatherings, we sponsored the food in those monthly gatherings. We have occasional entertainers, and we're now in discussion with Morningside Heights and Catch to expand and get additional entertainers and expand to the tech programs. These are some of the flyers that we distributed throughout the community. This first one was out of the 2023 out of St. John the Divine. The second one came out of the Antioch Baptist Church, and the Antioch Baptist Church has been helping us a lot, and they've also donated their space. And they also hosted the holiday party this year as well. And these are some of the pictures that we have done within our Thanksgiving events in 20. This was 2023, which was our first event. This was pretty active, and the NYPD actually assisted us by busing seniors from different retirement buildings in the area and actually brought them back after they had their meal and their entertainment. This was in 2024. This expanded tremendously, and based on our experience from 2023, the NYPD ceremonial band participated in our event, and this was out of the Antioch Baptist Church, which was a bigger event than the year before. And this was a recent trip to the Winter Wonderland in Westchester County, where we combined seniors from Morningside Retirement as well as Catch, which was a big success. We also provide in-kind gifts to seniors. We get donations from, YSL, L'Oreal, blankets from Costco. Sometimes we purchase them and distribute them throughout the communities. Columbia Community Services is a great assistance in guiding us on where to distribute these products. These are some of the other events that we've also participated in West Harlem, which is the backpack event and the Together in Harlem Day with the NYPD, where we're distributing backpacks. And again, as I discussed, these backpacks are usually stuffed and gathered with some of our senior volunteers to give back to the community as well. Some of our upcoming projects is we have more monthly social events at the sites at Morningside Heights and Catch, but we have a Foxwood trip coming up around April, May, where we're sponsoring the bus. There's a potential botanical gardens trip in April, May as well. And we're continuing to work with the 26th precinct for the spring summer events that are coming up. These again are pictures that are based on some of our interns that are distributing the products at the events. These are our lovely police officers that are helping us. And these are some of the seniors that are helping us wrap presents that are distributed at the toy distribution with the NYPD. These are more pictures from our Rockland County sites, but I'll leave it at that. Does anybody have any questions?
Thank you, Anthony. I had a series of distractions. So but briefly, how long has Alms been in operation? Because I'm sure I missed that.
Yeah, we've formed in 2021. We've been in West Harlem since 2023.
Okay, and just repeat where your office is again.
Where our physical offices are in Rockland County, we work out of facilities in New York City through what NYPD assists us in getting us sites to work out of from time to time. But I have to be honest, West Harlem has been extremely generous. Whenever we needed a space, there hasn't been an issue finding a space to work out of whenever we need to.
Okay, and if you have an issue, you can just contact us here at the district office and we can see how we might help it, because I know that within this district, there's requirement that, services be provided. So just let us know how we might be able to help in terms of space,
Sure. Thank you.
office space. Any other questions?
Laquita,
Yes, Victor. Victor Edwards is the chair of Community Board 9, and I am very grateful that he is here with us. He visits with us often. But thank you, Victor. You have a question or statement?
yes, thank you for your presentation, Mr. Michaels, appreciate it. I noticed you had mentioned the 26th precinct quite often in your presentation. I was wondering if you had any contact with the 30th precinct, which is a little further up within our district, and we do have a lot of seniors that I think that could benefit from this. If not, we could certainly make the connection for you.
Sure, if you can make the connection, we're more than happy to do so. The connection with the 26th precinct came through Columbia Community Services, because to be honest, what we wanted to get into West Harlem, they were the first people that we contacted, and they
Right.
guided us to the 26th precinct. And the 26th precinct led us to Catch, and Columbia Community Services led us to Morningside Retirement and Health Services.
Okay. So now the other question I was going to ask, a suggestion, we have a senior committee as well that's very active, and they have a lot of connections in the community that might, benefit from your program as well. So I'll get your information and have someone reach out to you regarding that as well.
That would be fantastic.
Okay, thank you.
Sure.
That's a good point with the seniors committee. In addition, what we've been able to do through hosting and learning from the West Harlem Development Corporations is that many of them consult and join in partnership with some of the other grantees and recipients and some of our other community partners. And many of them, as we request, stay in touch. They continue to participate in our meetings going forward, and we would love for alms to do the same. It's really important to keep the connection, and
Sure.
they find that they benefit from each other. We do have, a number of other agencies that are offering services of food, the food pantry, some of the other services that the counseling. Of course, the demographics may vary a bit. Yours mostly seniors. Some of them are, have services provided to families, or to single mothers, et cetera, or formerly incarcerated. So the demographics may change, but oftentimes they enjoy making connections and put their information in the chat, which you should drop in as well. And I think you might have already. I'm not sure if you haven't. Please do so.
Sure.
Any other questions? Heather, anybody else's hand? Okay. Okay, thank you again, and the best of luck and success to you and the organization, Anthony.
Thank you.
I don't believe there was any response to another, let's see, let me check the chat. Oh, someone's having audio issues. Oh, that was, okay, Christopher, sorry. Okay, greetings. Okay, I don't think there's anyone else, who has presentation that I might have missed from WHGC. So I'm gonna, because we were ready for the discussion, that's gonna really be important to our community. I'm gonna move forward with Deborah's project concern and request for letters of support. She's gonna give us some background with that. And Deborah is a key figure at the City University of New York. She's director of the Harlem Health Initiative. And she's just a great friend, great partner. Anytime we need anything, Deborah is prompt to answer and help in any way that she does. You know, thank you, Deborah, for being on board, and just tell us about why you want the letters of support and what projects or programs you're looking to do.
Well, good evening, everyone, and thank you, Laquita, again for always being available to sort of listen and sort of help us figure out how to move ahead in terms of public health and ensuring that our communities are well taken care of. So thank you, Community Board members, for allowing me a few minutes tonight. My name is Deborah Levine, as you've heard. I'm your Community Engagement Officer for the City University Graduate School of Public Health and Health Policy. By training, I'm a clinical psychiatric social worker, so you get a little bit of best of both worlds. On behalf of the Dean, he brings greetings tonight and also asked me to pass along a word at our loss of Dr. Hazel Dukes and knowing the impact of the community. And he wanted the community board to know that the school is in mourning and we are here to be supportive in any way that we can to the community. So having said that, let me make sure that I give you the information that is essential. Some of you may know, and some of you participate in an initiative we have called Harlem Strong, which is a mental health task sharing project that we work with several of the FQHCs and community boards 9, 10, and 11, along with community-based organizations where we train community members to identify anxiety and depression. And we have a whole training module that's online, and they get to meet with supervisors and walk through a process. And we make referrals and support people while they're waiting for their appointments in clinics through some basic mental health skill sets. This has been a conversation that we've had also with the State Mental Health Association and also members of NASW about being able to create a mental health certificate program. And so last year we received a little under $200,000 to begin crafting the materials to look at how we would be able to do a certificate program that would work with anyone from as a community health worker or in a community-based organization in an alternative staff role that doesn't necessarily provide mental health to be able to get a certificate that would be recognized and certified through the state. So this year we're coming back as that work is starting to really ramp up. We're taking a lot of the lessons learned from Harlem Strong and our youth initiative also to be able to build out that curriculum. And so that is what the first letter is really about, is the community care model for mental health wellness. It's going to take us a bit more time to really make sure that it's culturally competent and that we are really being able to match it. Like if you're familiar with substance use, they have a certificate program also that's 350 hours. It's nationally known, it's recognized, it helps build workforce capacity in our community-based organizations and also helps people in terms of their own workforce development. So I'll stop a minute if anyone has any questions before I move to the next letter.
So this is a certificate program that you're looking to
Yes.
provide programming. And
Yes, and it's modeled after a peer education program that the state does also around certification. And again, it's just a way of helping to standardize and will also, like we said, help with workforce development issues and filling some of the gaps.
the Harlem Strong Survey, is it still ongoing, it's still in process?
Yes, the services are still being offered. We're still working with several of the FQHCs, Harlem Congregations for Community Improvement, and a bunch of other community-based organizations across 9, 10, and 11 to provide those services. As a matter of fact, we were just at the senior center with Richard last week doing an update for them. So I'm happy to come back and talk to you more about Harlem Strong and give you an update as to where we are in that process.
Right, that would be great.
Sure.
Second letter?
And the
Oh,
second
wait,
letter, sorry,
One
somebody,
second. There's, Deborah, there is another question.
sure.
What are the requirements, to the program, are there any specific requirements?
Did you hear that? Are there specific requirements to be in the program right now?
No, ma'am. Right now, what we're doing is building the actual curriculum. We're taking all the lessons learned from COVID, taking the lessons learned from Harlem Strong, our mental health youth program, and working with the National Association of Social Workers and also the Mental Health Association statewide to look at how we can build this curriculum out. And so we have modules, but it hasn't been launched as of yet.
Okay. All right, so continue, Deborah, the second
Okay,
letter.
and we're hoping that once the curriculum has been reviewed and the state has had an opportunity to review it and go through it, we'll also be able to raise enough money that we'll be able to support the cost of organizations sending their staff and others to the program for a very nominal fee, if not for free. That is the goal.
Okay,
The second project, I mean, you've heard us talk about this. This is actually in collaboration with Columbia University, is the Pandemic Response Institute. What we learned through COVID, and as we are seeing with other, natural disasters and other potential pandemics, is a real need to have a public health emergency preparedness response training hub. We had a lot of volunteers during COVID. We had a lot of community support. This again would be a certificate program where we could have more boots on the ground as we are waiting for the government and others to respond. It would be based on a community response. And so the training hub would do a few things. Again, strengthen our community-based organizations, because the goal would also to have several staff members in each of these organizations to be trained in public health emergencies and preparedness response trainings in a coordinated effort, to build out the coalition in communities like Harlem so that when these things happen, we're not sort of again depending on either social media or word of mouth to try to coordinate. So this is another ask that again, last year, we were granted a small amount of money, about 125,000, to begin taking the lessons learned, and looking at ways that we could build this out. Again, looking at it from a community health worker's perspective, to our students, to community organization staff. And believe it or not, there are themes that run from this that have come from your needs assessment, Community Board 10's needs assessment, 11's needs assessments, and also looking at 12's across, looking at some others from other boroughs.
thank you, Deborah. Does this, oh, now it escapes me, there was a program that was started a pilot program, to combine, let's see, the police department with a couple of people, but unarmed, uh, and psychiatrists, a couple of psychiatrists, and social workers. I don't know how well that turned out. I think that they had to pause that program. It didn't go so well, but I was going to ask if it was similar. And to tell you the truth, I can't even think of recall the name of it. But we knew.
Be heard.
Yes, be heard.
Be
How
heard.
is it not similar to that you think will make
Oh,
it
it is
successful?
really community driven. And so again, as we have learned, the community responds very differently than sort of our organized entities. And so this gives us an opportunity again to really put a plan in place and to train community members and community-based organizations to have a standardized training program that again would be coordinated in each of the communities so that there is communication, and I'm trying to say this in the nicest way, that is driven towards the things that are most needed in our communities, like being able to ensure that our seniors are fed or the vaccine sites are where they need to be. And in light of this new administration, coordination and communication are going to be utmost important.
How long do you think it'll take to really get off the ground if you get the funding you need, say, fall of this year? And it's a small amount, that will be just setting it up, I suppose. How long do you think it'll take to really be up and running with the number?
Honestly, we're already starting to write the curriculum. We've already done sort of like the basics for putting this together. It's really wanting to make sure that we are able to field test it, that we're able to talk to other colleagues that are doing pandemic responses in a community-centered way. So I would probably say, depending on when we get the money and depending on what happens, probably a year to 2 years out.
Mhm. Let me correct myself too. It was the Be Heard program I was thinking of, but if I remember correctly, theirs was dealing with an mental health crisis being called.
So Be Heard was actually a project between the fire department, the Department of Health, where they would combine and if somebody called in crisis, as opposed to the police going out, they would go out and be able to do quick assessments, referrals, even in some cases, escorting people to the hospital when necessary and needed, but a bit more of a friendlier touch, less traumatizing than coming up with the sirens blaring and, yeah,
Guns drawn and all of that.
right. So that is basically our requests, and they're layered on to the things that we're currently doing in the community. So it's another way for us to be able to integrate and strengthen the work that we've been allowed to do. So thank you.
Thank you, Deborah. So hang in there with us. At the end of the meeting, we will be dealing with the official business of resolutions, letters of support. Let me also mention before moving to the next thought, we have a dear friend, particularly a dear friend of Victor Edwards and mine, that we learned passed. That was Dr. Cynthia Grace, who was a psychologist. She was on a number of community boards here in the city. She was a professor at City College of New York for quite some time. And we just learned that she passed last week in the state of Florida, where she had a second residence and business, and it was sudden, totally unexpected. And she spoke to our committee in December as we were beginning the discussion on post-election trauma and stress and coming into the holidays. It was wonderful. So I'm hoping we can save that discussion that she had with us and make it available because people learn so much from it. And she was, just had a heartwarming presence, caring, toward people and I'm sure her clients. She was totally engrossed, immersed in her profession. And I'd known her for years, and she was also not only the psychologist, but this businesswoman as well, and very charitable. So I'm really deeply saddened to hear that, and so we'll express our sympathy. I'm not sure, Victor, if you had anything in particular to add. I know Wendy just sent, yeah, people who were on the line with us today, it was a big Zoom turnout as well. And, people are expressing their sadness. It was quite a shock. And Victor may have stepped away a second. Now, moving forward, now, Dr. Williams, Dr. Lajity Williams, I don't know if you want to sit there but if you sit next to me, more people can see you. As you have a discussion? Oh, the camera, you're there? Okay. So he's comfortable where he is, and this will be a chat. There's so much going on, and it's not political, but it is certainly government, and it's our lives that are held in a very off-balance way because of what is happening that is very erratic. Most of what is happening not only, I guess, primarily affects people's jobs, but secondarily, and that really is primary as well, it's our health. Our health is, and our healthcare system is under attack. And I think, especially now, looking back, yes, there are things that we as people would want and we would ask for and demand, and we felt could be better, but we didn't feel that it was that raunchy, that bad, that it required this kind of upheaval with the pulling the United States out of the World Health Organization, closing down National Institutes of Health, or certainly lessening it and crippling it. We don't know how research grants will be affected, but we know that they will. Medicaid is under attack right now with so many employees gone. Anyway, it's just so much happening to us. And in a lot of ways, we feel helpless, but not totally so. And we're hoping to have a discussion on that. First of all, we have to be able to help our communities. We have to be able to give them some assurances in terms of where to go, what information they should listen to. CDC, Center for Disease Control, is going to be terribly affected because we really don't know if people put in these positions really know and care about medicine and healthcare. And we know from the first COVID how pandemic, how the head of government wanted to say, oh, just shoot bleach up your veins. It's just it's crazy. So we need to at least know who the credible, or try to know who the credible for sources are out there for us to the best of our abilities. But this is a start. We need to talk about it. And now is the time, even though we're not going to have all the answers. So I sent out a brief bio on Dr. Williams. Olajide, I love his name. Am I pronouncing it correctly? Dr. Olajide Williams is the Vice Dean of the Columbia Health program at Columbia University. And he is also vice chair of the Department of Neurology and a specialist in the treatment of stroke and cerebrovascular diseases. He is a I have that. I have that twice, I see. He is an attending physician at New York Presbyterian Hospital. He has a lot to his credentials. He's internationally known and esteemed as well as within the city. So, Dr. Williams, what are we gonna do? What should we know? What should we, and the questions are gonna be open to everyone. People are, waiting with bated breath to ask questions. What do you want to say as a general view of the questions? Oh, you'll get feedback.
Yeah.
You have to, I need to block myself.
Mute yourself.
I'm already muted. Both phones.
I think if we could only have one minute, so.
You don't need the mic, because we have a mic here.
Oh, you can hear me?
Yeah.
Can you hear me?
Can those on Zoom hear Dr. Williams? Give us a sign.
I can.
But clearly.
But I just
Oh, they
come.
can hear you.
Oh, they said they can hear you.
Yeah.
Okay, but you can still.
Somebody
I'll
takes
just-
it off.
Oh, then-
So thank you for that. It's good to be here, community board night. But I'm actually here with, I'm here with the Vice President of Community, the Office of Community and Academic Partnerships, Sandra Harris. Hey, Sandra.
Dr. Williams, you can just look over here.
Oh, I can look
Yeah,
straight.
you don't have to look down,
Oh, okay. We're good, okay. So, this is a difficult time. And I think, the first message that I want to, share is that there's a lot that we don't know. It's better when I look right at here, right? There's a lot that we don't know. And I think it's really important for everyone to be as calm as possible during this crisis, to focus on building resilience. After 100 days, we'll know a lot more. Right now, there have been some frightening executive orders, but there's also been there has also been significant legal activity that has resulted in court injunctions that have paused a lot of those executive orders that affect at least us in healthcare. Speaking from a Columbia University perspective, what are we most concerned about? We're concerned about a lot of things. We were initially rocked by the DEI bans and cuts, and the marginalization that's rebounding with this current administration. Diversity, equity, and inclusion has now become a pariah word. Those of us who are doing that work find ourselves being pushed to the periphery of the research enterprise nationally. We've been even asked to reframe how we talk about these issues. rephrase the type of words that we use to describe these issues, and dance around these issues. But I personally believe that we cannot afford to walk away from the moral obligation and duty to serve and protect and champion the most vulnerable in our communities. And so there are many of us here at Columbia, including Sandra, who's here, that are working around the clock to find ways to continue to preserve our mission and our commitment to the community. But it was never easy, as all of you know. And it's going to become even harder now. It's going to become even harder now because of the financial constraints and the headwinds that have been unleashed by the proposed cuts to our research enterprise. Now, just to explain what indirect costs are. For example, if I apply or write an NIH grant to increase colorectal cancer screening, these are examples of the types of grants that I have. I have another grant to increase depression screening in Black churches. I have other grants that focus on supporting patients inside their homes with a community health worker, with a community social worker, and with a community nurse to help them navigate back to recovery. So these are just 3 examples of some of the NIH grants that I personally have, and I'm using personal example, hopefully to bring the threats to life. Now, for every dollar that my NIH grant earns in direct costs, the university gets 64 cents to support my research infrastructure. In other words, my space where I sit, where my community health workers sit, where my research coordinators sit, the people who are going to be supporting the grants management, the budgets, the audits, the purchase orders, the people who are responsible for, supporting my staff, for maintaining my lab. All of these go under what we call indirect costs. So for every dollar that I get from the NIH, the university gets 64 cents to support all of these costs. At Sloan Kettering, and each institution negotiates that particular indirect cost. Sloan Kettering, for example, has an indirect cost that I think exceeds 90 cents to the dollar. But it's different for each institution based on the negotiated rate with the NIH. So what the administration did with an executive order was to cut everyone's indirect cost rate, ours is 64 at Columbia, down to a flat 15%. So imagine going from 64% indirect cost rate. The institution gets 64 cents on every dollar to support all my work, the staff that I need, the space that I need, the infrastructure, all the OTP, all the things that I need to successfully do this work in the community. That rate has now gone from 64 cents to 15 cents. So that renders me powerless, because now I won't be able to have the supporting infrastructure and services that I need to successfully engage in my colorectal cancer screening in Black communities, engage in my depression screening research, engage in my social determinants of health mitigation research, all of which is funded by the NIH. And imagine, multiply me, I'm one investigator. If you multiply me by the hundreds of investigators doing NIH research, you can see how our ability to continue to do meaningful research, ranging from the community-based research that I do, all the way through to our ability to discover new treatments, to discover new drugs, to discover new vaccines, to discover new devices that support heart transplants or heart failure. Colombia has been, as many of you know, the place where a lot of discovery has taken place that have supported the advancement of our medical supported medical advancement. So our ability to continue to make these types of scientific discoveries to better health for all people has been crippled with a single blow to those indirect costs. Now, I'm talking about multiple millions of dollars that are going to be affected by this. Now, the good news today is that there was an injunction that has put a stop to that executive order. And we suspect that two things will happen. One is there's a lot of negotiation, and we end up not at the 15% mark, but maybe at a 35 or 40 or even 50%, or it goes all the way to the Supreme Court and the 15% holds. But we don't suspect that would have, we suspect that will be a compromise somewhere. But again, we don't know. So because of that, we have done some simulations at Columbia to understand what the financial blow would be across all the different scenarios. And we know that if the worst scenario was to be realized, that could mean not just crippling of our ability to continue to make discoveries in science and health, but it also lead to job loss, and it would also cripple our ability to continue to be a leader in healthcare discovery and innovation. So with these simulations, we're coming up with the numbers that we're going to need to remain solvent within our research portfolio, and what type of options we have for attracting and diversifying our research portfolio beyond NIH research through philanthropy, industry, and other arms that hopefully will support our research enterprise. And so that is the state of research as we know it here, as we know so far. You know, everything changes every day. So what I'm telling you today could be very different in 1 week. And what I tell you in 1 week can be very different in 1 month. It's a very dynamic period that we find ourselves in. That's why we're not panicking. We're making contingency plans, but we recognize that we really don't know what's going to happen. All we can do now is continue to push back against these policies. When it comes to DEI, for example, again, similarly, there's been an injunction on a couple of those executive orders. But if you look at the Columbia website, you'll still see all our DEI office are still represented in the website. A lot of institutions have taken them down. If you go to our website, you'll still see all our DEI office are still up on our website, and we're still, we're still working within the confines of the law to provide support to all people, including those who are most vulnerable, who live in our local communities. We're also very concerned about Medicaid, especially Medicaid. I believe the hospital New York Presbyterian Hospital is going to bear the brunt of any major Medicaid cuts, but at Columbia Doctors, we still have significant exposure. We know, for example, that the House Budget Committee voted along party lines to seek at least $880 billion in mandatory spending cuts to Medicaid programs. We know that here in New York City, we have about 7.5 million New Yorkers are on Medicaid. We know that 4 million people in New York City are on Medicaid. We know that 5 in 8 nursing home residents rely on Medicaid. 2 in 7 people that have Medicare also have Medicaid. 4 in 9 people with disabilities are on Medicaid. And 1 in 4 low-wage workers also rely on Medicaid. So Medicaid is a big, big part of New York City. And we really don't know how those proposed budget cuts are going to play out. It is a very difficult decision also for Republicans because a large number of Trump supporters, a large number of red states have huge Medicaid populations, and a number of them, especially those who accepted the Medicaid expansion under Obamacare, have large Medicaid populations. So this is an issue that crosses the political aisle. And we really don't know where the Medicaid proposed cuts will end up. Again, we're watching this. We are hoping for the best, but preparing for the worst. Medicare, again, is different. If you read Project 25, which is really where we try to glean where the administration is going, is so far, Project 25 has been pretty predictive of a lot of these executive orders coming out of Washington. We know from Project 25 that they would like Medicare to default to the Medicare Advantage, making Medicare Advantage the default choice. And we know that that comes with a lot of challenges. We know, for example, that Medicaid Advantage is offered by private health insurance companies, for example. We know that network restrictions may apply, requiring switching of your doctor. There's more pre-authorization required. The coverage is variable with a lot of unanticipated costs, disparities in patient experiences. We know that not all plans provide the same level of benefits or quality ratings. Often we see higher out-of-pocket expenses for certain services with Medicaid Advantage, including specialist visits. So that is what we hear from Project 25, but we really don't know what's going to happen with Medicare. Again, I'm going to hand it over to my colleague, Sandra, just to say a few words, but my general disposition is to remain calm, to continue to plan for the worst and hope for the best, and to remain resilient. We know from our history that our ancestors have been through far worse. Generations before us have been through far worse. And I have no doubt that we will be able to come through this situation with resilience and hope still intact. I do think it's going to be more important than ever for everyone to pull together. I think it's going to be more important than ever for more collaborations. We are stronger together. When individual components come together, they tend to become greater than the sum of their component parts. Collaboration, cooperation, and coming together is going to be more critical than ever. We need to stand united if we are going to weather the storm, the stormy winds ahead of us. And so I'm gonna stop and let Sandra say a few words, and then we'll be happy to take some questions.
Just gonna say that, GDA really, provided a lot of the things that we're trying to do. We're here, we're looking to forge stronger collaborations. As he noted, this is the only way that we are actually going to move forward, and really overcome, these challenges. I think that's something that, is also very important for us as a community to begin, and this is something that we've done with this board and around throughout our community, to have a greater understanding of research, right? And what can happen in terms of looking at these disparities when we fail not to engage and involve those most vulnerable, and especially our communities. So I think that we definitely want to seize the opportunity to continue to come to the community, engage in conversations, and also really forge stronger collaboration so that we can together begin to answer some of these questions and really answer the call of how do we move past these challenges to make sure that we continue to provide quality care, engage research, and also continuing to look at our communities from that perspective of health and well-being together. So we want to open it up for questions. And before, and it can come up even after this, can you speak to community clinics, community health centers in terms of Medicaid? If there's any, how they would fare just generally in this environment and with what's going on?
So, I mean, we.
We have some of the
Yeah,
doctors and all
Columbia,
on this call.
yeah, so Columbia, we don't run any FQHCs, these federally qualified health centers, but I have good relationships with a number of federally qualified health centers. And as you know, some quite a few FQHCs, they have higher rates of reimbursement from Medicare as part of that package. So my conversations with a lot of FQHC executive directors is consistent with everything that I've said here. They are very concerned about cuts. They're heavily, as you know, they're heavily dependent on public insurance. It's their staple diet. And they're critical to the community. These FQHCs are the front line. They are the ones really doing that primary care, life-saving frontline work under the harshest conditions. And so they are very concerned.
Even in terms of immigrants, because they accept immigrants, and now that is also
uninsured. You as you know, charity care. We provide charity care uptown. A lot of FQHCs actually have, through different statutes, the ability to absorb a lot of immigrants into their care. Between the assault on migrants and immigration, and cuts to the places where they seek sanctuary and healthcare, the situation is potentially extremely challenging. But again, this is a dynamic situation. There are a lot of lawsuits, there's a lot of pushback, and we don't know where things will land. But everybody is preparing for the worst as we hope for the best.
I know there's some questions. If I just speak up, there's a hand up there. There's three. There are three hands. Okay, do you want me to, let's call in this order. I'm not sure which hand was first, but I see Edwin's hand. And then who else was it? Heather?
I see that one was first, so let everyone know that.
Edwin, go ahead.
Thank you for the presentation. And I think that, it was very well highlighted the impact this is going to have. Folks, I see patients that cannot afford their insulin and they work in the community. Now they're going to be without it. These are patients who have type 1. it means that they will literally die without their insulin. They're going to show up in the ER. If so, people are definitely afraid. But to be short-sighted and think that because you're undocumented, you don't deserve care. Communicable diseases. The good thing about viruses and bacteria and fungi is that they have no feelings. Humans, we have tons of them, right? And when these diseases, they spread, they spread to everyone. It doesn't matter who you are. Let's remember that folks, they live in our community, and low vaccination rates have economic consequences when folks cannot get their vaccines because they can't go to seek care because now the HQSC have been, stranded. I think that we're going to need our public health department, to pick up in our state health department. It's going to be a big, painful time, but like it was said, this is, temporary. Hopefully, right? 2 more years, we have to fight so we can have a change in the government. Let's remember that we have 3 branches. We don't have only one, even though now it seems like we only have one. I think I would like, to hear what kind of program is Colombia having, and if not, for them to think about these folks who don't have these services. Telehealth services can be very helpful for these patients. They don't want to show up to clinics. They're very afraid. They are, you can have free in front of your clinic, and they will not show up because they're seeing the video of ICE showing up. And I think that for us, we should be looking into this where we can have at least some free type of services virtually for these folks, and we can help them just weather these 18 months that we have going until things can be a little more balanced.
Yeah. Ed, thanks for your comments. You always make very insightful comments.
Mm-hmm.
One of my biggest concerns, we were actually just discussing this last week, is that telehealth services, coverage for telehealth services are set to expire on March 31st. So Medicare will no longer be reimbursing for telehealth. And we suspect once Medicare leaves, commercial will follow. And which is a huge concern because, as you said, it's an opportunity for us to meet the needs, the clinical outpatient needs of certain groups without exposing them to the risk of being rounded up, in a hospital waiting room. But that's set to expire. I know that there are people trying to push back and get an extension, but it's not at this point looking like that telehealth coverage will be extended beyond March 31st. The insulin issue is a real tragic issue, especially after Biden was able to lower the cost of insulin, and to have that just rebound is going to affect so many kids, so many children with type 1, so many poor children with type 1. And I think that, you're right. This is where working together, pooling resources, collaborating, and finding ways to try to protect the most vulnerable among us is going to be critical. We need to look for new models for healthcare, new models for revenue generation. We need to think outside the box. How do we create hub and spokes with FQHCs so that we can support FQHCs in different ways that we have in the past? And so that there's a lot to be done, but we certainly have all options on the table, because this is a fight that I think that's going to need everybody rolling their sleeves up, and everybody working together. You also made a great point, Ed, about infectious diseases. I remember when COVID, we all remember what COVID did. I remember the folks on the Upper East Side were terrified of COVID rates in Spanish Harlem. I said, give them coverage, make it free, make vaccines free. because they realize that, hey, we're actually all connected. We're actually all interdependent. And what happened, if COVID rates soar in Spanish Harlem, it's going to affect folks in the Upper East Side. If COVID rates soar among our hospital cleaners, it's going to affect the hospital doctors and the patients. We are all interconnected. And I agree that this is a short-sighted approach to healthcare because you cannot compartmentalize healthcare. Infectious disease, we're already seeing measles down south.
Yep.
Measles cases. And so I do agree that I do think that it's going to be hard for them to sustain this path without significant blowback as things start to spiral out of control.
Now, I don't know if I know people are taking it all in. That's what I'm guessing is happening right now. How do we now encourage more vaccination, immunizations of children, especially come September, with people now seeing that with this measles, they should have seen it before because this is not the first time, but now with everything else, I believe that measles outbreak and death in Texas has made a more profound impact, more so that one, for right now it's one, than whatever was said a few years ago. And where vaccinations were still, poo-pooed by a large
Yeah.
number of people. How do we announce to the public about our public about vaccinations for children?
It's gonna require
And where do they go?
all hands on deck. The Department of Health is going to need to play a critical role both at the city and the state level. And I think we're gonna have to combat misinformation in ways that we haven't. We thought we were combating misinformation during COVID, but this is next level. This time it's going to be on steroids because we have a new head of HHS that questions the efficacy of and wisdom of vaccines. So it's going to be a next level misinformation, and I think it's important and incumbent on all of us to continue to promote and champion vaccination among our children. The last thing we need in the middle of all this suffering is for our children to start dying of diseases that have once been eradicated.
I believe polio, there's some incidents of polio in one child. There was one a few years back, but I think another one just crept up.
And we're going to continue to see as people start, as this disinformation campaign it gets translated into policy, which is the greatest fear, especially with the leadership at the HHS. It's going to be important for the states and municipalities to do everything they can to protect their citizens.
Well, Dr. Williams, now we know that we cannot rely on the federal government, and it's going to fall on the state and on the city, which is a lot of strain. I think, for us at the community level, please let us know how we can help. My thought is that we should go through philanthropy. There's still a lot of philanthropic, forces out there who are very, sane with their donation. And more than ever, we can make up a case to try to create a funding line that can be temporary to try to mitigate some of the impact that the current rhetoric and policies can have on the community. We're not asking for a grant for 20 years. Just get us through the midterm, and then we can pick up from there.
I think that's a great idea.
And who would it go? Edward, do you think it would go through? Would it be monitored by the state?
Not necessarily. Dr. William himself, his team, Columbia, they can go to, Melinda, who divorced Bill Gates. She's very philanthropic. You have also Bezos' ex-wife, who's also very philanthropic. These are folks who, if you look at their funding patterns,
Yeah.
they tend to be very sane. You also have this other guy, Warren Buffett. There's a lot of philanthropic, the Robert Johnson Foundation. They've been, they're going to be stressed too. But I think this is just a temporary, funding, so we can be able to have televideo for those who don't have insurance, those who are illegal immigrants in our community, who would not be going into the ER, who will not come into the office. No matter what you say, you can give them money and they will not show up. But TB, any respiratory virus, measles, they can care less about how human feels. They will propagate. We'll see their kids in the school. They'll come back to, so these are things that we have to think about public health. And some of these guys, they think in very short term.
Yeah, no, I agree. I agree with you. Philanthropy is something that we are actively pursuing. And I actually think that once the 100 days is over and the dust settles and we know what is what, I think that's when you're going to see a lot of philanthropic machinery turning up.
So any letter that you need from us, we'll I'm sure that everyone in the community will write one independently, and the community board, I'm sure they will also.
Thank you so much. It's been an honor and a pleasure to be here.
Should there be with a task force, a community task force that includes, well, of course, Columbia heading that, that up, and then incorporating others impacted, like, we only have a couple of FQ, three in our area, there are three. So those three and some of the other doctors that deal with
Sandra and I
Medicaid.
have talked about this. Right?
Yeah, definitely a task force would be, should be in place at some point. I think that the overall message is we need to wait, believe it or not, for these 100 days, right? And as we contemplate these different scenarios, one of those, anywhere, Eric, when I hear your recommendations, how do we get a task force on health promotion and education? How do we loop in our community health workers who are already trusted in the communities to do that work? But then there's with the AQACs, how do we create a space to service these individuals? Do we do a mobile medical health services? So there's a lot of things that we need to quickly, right, pivot in terms of implementing these services and tap it into the philanthropists who would support us in this mission. But I think that right now we're looking at all of these scenarios, and I think definitely a task force, and maybe several local task forces, right, so that we can tap into all of this.
And I actually think that the hospitals need to work together.
Yeah.
I think whether it's Mount Sinai, Columbia, Harlem, Lincoln, all of us that are serving Northern Manhattan need to work together like we've never done before, right? We need to take collaboration and coordination to a next level. All our government and community affairs departments need to know each other. We need to have a Northern Manhattan, South Bronx, inward, like, task force and coalition for this area that includes not just the community boards coming together, but the hospitals coming together. I think we need to be as collaborative as possible, because that's the only way we're going to get through the next 2 years.
Guys, can I interrupt here? I don't know how to use the phone in terms of putting a hand up. This is Sandra Gale. I'm the CEO over at Heritage. And I just wanted everybody to know very quietly that, as some of you know, we led the litigation charge against the state when they took the 340B money from all of the groups that were affected. And I wanted everybody to know that we were working in the past several weeks. Some of us were working 20-hour days, making certain that some of the preliminary injunctions that were filed were in fact filed. Some of you know I am an attorney, and I take the violations very seriously. And so there was a preliminary injunction filed, as you all know, on behalf of the National Association of Nonprofits. So that everybody is clear, if I could just, this is not legal advice, please, but just to give everybody a little bit of an update,
Sure.
because while I want to work on the task force with everybody, I am inundated with respect to the legal matters and will continue to be so. And Gita, you and I could have a cup of coffee soon. I've actually been meaning to reach out to you in the past couple of weeks. But what I'd like to do is just take a moment and go through a couple of things that are the most concerning for the lawyers that are involved. And the first thing is that while we have 3 branches of government,
Yeah.
I don't want anybody to be misled. We have a charge that came out of Energy and Commerce to come up with 880 billion in the next 10 years of savings. Now, you may say to yourself, that's a bizarre ask for Energy and Commerce when medical doesn't fall under Energy and Commerce. But Medicaid, Medicare, and Social Security are in fact being looked at. They keep saying fraud, waste. They'll take a look at anything and they'll remove it. The biggest concern we have is what I call a constitutional crisis, which is that a court renders a decision and tells them you must continue funding. We've been funded through December 31st of 2025. Article 1 of our Constitution has the power of the purse. It is Congress. It is they. It is not the president. But our biggest concern is that a court will render that the funding has to occur and they simply will refuse it. The biggest malevolence, in my view, is coming out of Vote. He is the architect of Project 2025. I've read it now 4 times. They are playing by the playbook. And every single thing that you have seen us do with respect to the preliminary injunctions we have been filing, and it's exhausting because I work full time and I have been dedicating our time to this. But I will share with everyone, and I repeat this is not legal advice. I have to be very careful here. Please make no mistake. While our group is working together and we're looking at the impact of what it means if Medicaid is to stop or Medicare, you have several people that are in our group who have the extra skill set of the legal aspect, working together and working sometimes till 3, 4 o'clock in the morning, making certain that we're doing what we're doing to stop this. There are several lawsuits that have rendered this unconstitutional. It is in my view that every single thing that has been done is unconstitutional. And I want to remind everybody, and when you're talking with your Congress to make the simple, or the legislatures make the simple statement, this isn't the mandate. He had 49.8% of the vote. On all 3 of his attempts, he never had more than 50%. And so with this nonsense of there's an overwhelming mandate, there is not. People are not being paid to sit in these meetings. These are real constituents fighting for their representatives to do what is necessary. Now, we have been told that some of these congressional leaders, some of the senators, they're following suit because they're fearful for their families. And while everybody says, oh, we just have to wait till midterms and we're only 22 months, 21 months away from it, we won't survive the FQHCs.
Too long.
Okay, this is craziness. And every single time we turn around and we see that our very own regulator puts access to health care on a much higher degree over the mountain. You can't get telehealth. You can't get certain things for COVID. Now we've got to go through certain requirements. Well, let me say something to you. I came out of retirement because racism to me is insidious. Genderism is insidious. Any form of discrimination whatsoever, it's insidious. And when you tell people that you can't have access to health care, and there are real studies that say these are mortality tables, and before you had Medicaid and before you had Medicaid expansion, and these were the numbers, and look how successful this is at reducing 27,000 non-deaths occur in this particular jurisdiction because they have access to health care. Yet you have an administration, and it is my own personal view, not the view of Heritage, but my own personal view that you have a buffoon in charge of this country. Okay, and so we didn't have a mandate for this, and there are an overwhelming number of constituents and population that overwhelmingly supports the beneficence behind Medicaid, Medicare, and Social Security. Please don't ever think that this is really a matter that we feel as lawyers will just play itself out in the equal branches of the government. That is really not what the legal community is feeling. The legal community is on heightened fear that we are at, if we're not already there, a constitutional crisis. Because if you have an executive branch that has already taken a power grab, you've got somebody by the name of Vote. He's most malevolent in my view than any of the other three players, meaning Vance, Musk, or Trump. And this person is coming out, and he wrote the Project 2025, lots of the chapters. They don't want to follow rules. They believe in an emboldened executive branch. If you want to take a look at the Constitution, Article 1 very clearly gives the power of the purse to Congress. It does not give it to the executive branch. And so this taking on it's a very prima facie case of a violation of constitutional law. And so there are several people. Sometimes we meet 4 hours on Saturday, 5 hours on Sunday, and the Zoom calls are hundreds of people from all over the country, the attorneys that are on these calls. And we are here. We will always be here. And I want to remind everybody too, please, because everybody's scared, they're fearful. We have the ability in our center to see people for behavioral and mental health within 24 hours. So if you guys have patients who are panicking because of ICE or what's going on, these are real concerns. Please let us know. Danielle Milano was also on this call. Please let us know, and we will have our behavioral and mental health team help everybody. We are here to help. And while you may not see our hands up on the task force, please be rest assured that it is only because I am inundated with respect to watching what's going on the litigation front, because I have that skill set, and we have other very good lawyers from some of our hospitals that are participating as well, and we are doing everything we possibly can. But where we really can help, and I've said this over and over and over again, we pride ourselves on, and it's really unheard of, we are able to see patients for behavioral and mental health crises within a 24, max 48-hour window. And we now have services on Sunday. I think it's every other Sunday. So please, if you guys need us, we're here for you. And I'm sorry, I can't, I'm on my hand phone. Hi, Jide.
Yeah, we should definitely reconnect, Sandra,
Yes.
and talk a little bit more about how we can work together.
Well, you have my private cell, and I'll shoot you off another one after this call just to say hi, and let's go get some coffee.
Sounds good.
And I'll be bringing Danielle Milano, who's our Chief of Medical Affairs, with us, because she has been working tirelessly around the clock 7 days a week as well.
Yes.
And we are still, and team, we are still on that charge of the 340B litigation. I don't want anybody thinking that we dropped that ball. And because of our team at Heritage, our tiny little choo-choo train team, as I say it, we led that charge, and we led that lawsuit against Kathy Hochul and the Department of Health in New York. And because of our efforts, every FQHC and safety net got their 340B money the last 2 years in a row. And we're very proud of that.
Amazing work, amazing work, amazing work.
Question, Sandra, do you have flyers or information you can provide us at Community Board 9 to distribute regarding your services? Would be great.
Yes, and
Oh,
Laquita, who knows us very well, we have a very close relationship with Laquita too. We will make sure that Danielle's on the phone, and Laquita, I'll ask you, even if you've got to text me on over. We have a brochure, we have everything. So, and we are trying to be as warm as possible. We worked with the department of health as well as HRSA to make certain that we were able, without having to change our scope, to have telehealth for behavioral and mental health on Sundays. There is a need. I mean, I get patients calling me sometimes at 11 o'clock at night saying, you know, my uncle needs this and he's freaking out and they need help. And so we are here and we will be here because right now we must work together as a community. The fear I am seeing in the phone calls we are fielding, people are rightfully being threatened, meaning their concern of it is real because they're being threatened. They're fearful. It's palpable. I mean, this is outrageous what's going on in our country. And it's outrageous that you have people sitting by and thinking this is okay. You got Elon Musk in charge. I've never seen such double dipping in all of my legal
Yeah.
career, and I'm 60 years old. It's not.
Agreed. Question for Dr. Williams. Dr. Williams, Victor Edwards here, Chair of the Board.
Hey, Victor.
How are you today? Thank you so much for both of you for your presentation. Very helpful of trying to organize our communities and alleviating some of the fears that we can move forward, but not putting it in the back burner so we're not paying attention. Is there anything else the community health workers can do that come out of the center there up the street to help people in their homes or through the phone, especially people who don't want to come out? I know you have the community health workers group. I was wondering if there's something else they can do.
So we actually recently just got some funding from private foundation to establish a bilingual CHW workforce, Victor. It's called In Touch Espanol. Where the goal is to work with the migrant community and to work with those who are and to support one-on-one at the home level, in the homes, support these individuals who won't come out. And so we literally just got, it was almost as if we got the funding just before November 7th of last year. Almost as if, you know, the universe, God was like saying, you're gonna need this workforce. So we're partnering with some CBOs, including a CBO called the Mexican Coalition. Our goal is really to create this bilingual workforce that can go into homes and shelters and sanctuaries and really support the health needs of these individuals.
Okay, that's great. If we can be of help in any way, please let us know. We'll surely go out to the community as well. Thank you.
Sure. Thank you so much.
So it seems like our charge is based on what Sandra was saying also, Sandra Gale, we should pick up the telephone and call our senators, particularly those who are not the Republicans primarily, as well as our Democratic senators and representatives, and say, this is what we want. We didn't vote for this other thing, whatever it is, to express, you know, our disapproval. It has some impact, you know, it may not, it's going to register. It has to, that's, you know, it has to. So that's one thing. The task force is a second thing. So that, you know, we probably need to meet, you to pull together or help us pull together for you those that need to be part of that.
I think that all the boards need to work together on that task force.
Yeah, in our case, 9, 10, 11, 12 would be our, I don't know, we might 7 or 8, we may be able to go down
at least 9, 10, 11, 9, 10, definitely 9, 10, 11, 12.
Right, so we'll see.
But Laquita, you know, I might suggest that we should talk to the borough president, because, you know, just because we're here in a predominantly, you know,
absolutely.
Absolutely. What I was going to just add to that is that not only we do a letter requesting that's of whoever you suggest at Columbia, but add to that the governor, the governor, Mark Levine, who's our Manhattan Borough president, and, well, even the mayor.
Yeah,
You know,
because
know
public
that
health
we
is
are- we are going
interconnected.
with this.
If we have an outbreak in our community,
And our
No
con, and SBI.
there's no
Yes.
community that is safe. You know, those folks who live in Tribeca, if we have an outbreak up here, they can get it there too. And that's the thing about public health and intervening and making sure that we have a healthy community.
The DMH will need to be involved, the
Who?
Department of Health.
And
Yes.
the Department of Health, right, city and state.
Yeah.
Because
And there's something that Edwin mentioned that's the third is a very important thing also is the third. So Edwin, but so there were third points of action from tonight.
And I would just say quickly that the voices that are being affected the most, they're not sitting in this forum.
Right.
They're not here. And, you know, we are the one who are creating a voice for them to try to help them. And not because they don't want to, but because there's a lot of fear. You know, people are, you know, going to work and rushing back home and they're just not getting out.
The fear is real because you see where some of the Republicans are. They know this is wrong and they are so afraid. Some are just in agreement perhaps, but I think most of them, very many of
So
them.
I
are
think we
afraid
should,
too.
one of the
fear
things
is
that
real.
Sandra and I would do is try to conceptualize with you
Mhm.
guys
Mhm.
what, you know, what the task force could potentially look like.
Mhm.
To work together on pulling a citywide task force together. To really begin to be proactive as opposed to reactive
Right.
on this issue.
And then, I guess, we need to wait in terms of doing a resolution, or maybe we could do some resolution even before the 100 days. But be prepared for, as Dr. Williams says, look for the, expect the best, but hope for the.
Prepare for the worst
Prepare for the worst and expect the best.
and hope for the best.
Hope for the best.
And I think to Sandra's point also, the way I see the task force is making sure that as a community, we're well informed. Because as Enwood noted, the people that need the services and the support are not at the table,
here.
so they're looking to us to have the information, to help them navigate, right, a weird kind of system. So I think that looking at that task force and remembering being really up on top of what the legal issues, I think that I want to extend my thank you to Sandra and to many of the lawyers that have really had our back and the community's back and are in that court working through weekends 24/7 in response. So we also, part of the work of the committee is making sure that we're listening and getting those updates from the legal aspects of
And
things.
also promoting services that people aren't aware of. I mean, Heritage sees mental health patients on Sundays. You know, they have a 48-hour turnaround for mental health consultation. That's incredible.
Yeah.
And that there's probably so many other types of gems within the community that we need to unearth so that everybody can benefit from. And that would be another goal of the task force.
Right, and we have a list of our community partners from the forum that we did last year. And I'm sure you also have community partners that we're not aware of. So we can combine them just for the standpoint
Connecting
of helping
resources
them
and
get
services.
information. It's a way of disseminating information to the community, because that may be the very basic way is the way they may get the information.
Yeah, we might even have to look at Deborah Levine. She's involved in the pandemic response
Yes,
institute.
it's Deborah.
And some of their they've done a lot of work on response and preparedness, and just
Taking that
taking
model.
some of the best practices as we and thinking about it within the framework that the task force comes up with. But again, thank you so much. This has been great.
This is 8:21. Thank you so very much for agreed to do this. Thank you, Dr. Elijah D. Williams. Thank you, Ms. Sandra Harris, for being our community partners, community leaders. And so we look forward to working together and hearing more. We'll have to do a follow-up on this. This has been terrific. There are a number of persons on the Zoom who are in the medical profession, doctors that have their programs, and I'm sure they're listening. And if you have questions, drop them in the chat, but also drop an email, a line to me, an email as well. We have Odette Wilkins who came in later. I want you guys to know her. She heads up a technology task. She's also an attorney. And she's been working on our behalf, and she, even last year, she was saying they're moving so quickly on everything related to technology that could be harmful to our area, and it's just not enough time to respond because we'll get the information, or they'll get the information too late, or just in time for maybe one or two persons to read it and get the answer out. So that's the kind of, and it's even more so now. So that's the kind of environment that we're in. But we're happy to have the support of partners, and we'll get through.
We will.
But I agree, I think 2 years midterm is too long.
As Sandra,
It's gonna be
as
hard.
Sandra said, the FKCs don't have 2 years.
Yeah, I don't think so either.
We need to deal with this
I
now.
don't think we're,
Yeah.
yeah,
Thank you.
all right, thank you so very much. Thank you so very much.
Thank you all.
Thank you, Sandra.
Thank you.
And so please get the brochures to the district office. And we have a general board meeting coming up. And if we can have a few of those pamphlets, generally 50 or more are in attendance at our general board, that would be great. Anyone who has brochures relevant to this, and Heritage the same, okay?
We have some things, Laquita. We'll make sure that we get them over to you, and we'll ask for you guys to handle the distribution if that's
That would
okay.
be
We could do it through an
Yes.
email to you, but right now we have the behavioral and mental health every other Sunday. We're looking to get it every Sunday, but we certainly have an entire team now. There's 14 of them. And it has been my personal goal and mission to get it down to 24 to 48 hours, and we are there. So let's please partner and communicate. And obviously we'll get it. Please, I'll ask you to get it over to Victor as well. Had a nice conversation with Barry the other night, so he knows what we're doing as well. And just so please keep us very close to you, and please know that we're doing everything we can to help our community.
We will, and thank you.
Thank you,
And
Laquita.
I think, yeah, the executive meets next week. So even if you have some available and we first distribute that executive, that will help. As soon as you can.
Yeah, I just texted Danielle Milano, who was on. Danielle Milano and I'm going to ask you, Laquita, to please continue to include me on these calls. I don't like
Absolutely.
speaking on them so much. I just like to listen. But tonight I thought it was important to at least give everybody an
was.
update, because we are really, we're trying our best to make certain that we are heard and that our people have access to healthcare. This is a shame. It's really just a shame what they're doing.
This is a big issue for us, so we're gonna be pushing this very hard. And so,
Well,
so
the optics are terrible. I mean, you're trying to get billionaire cuts on the backs of elderly, marginalized, and disabled is disgusting. It's just
and that's
disgusting.
just one part of it. It's just sickening what's happening in the
It's
country.
like Dr. Evil and Mini Me took over. It's weird. It's just weird.
Yes. Thank you. And I believe.
Thank you. Laquita, let's text at the end of the week, but we'll get you over that stuff. Thank you.
Okay, Sandra, thank you very much. Thank you all so much for being on this call and for your statements, questions, and just listening. Under our new business, we have the letters of support that, the committee members got them. We do not have a quorum, 1, 2, 3.
Well,
We do not have-
Laquita, I can't talk to you about the other matter. I can't talk to you about the other matter. This is still something that's being recorded, but we could certainly talk offline. But I
Okay.
have, unfortunately, I need to be on a 9 o'clock and I'm not prepared.
Oh,
for
yes,
it.
yes. Anyone, what I was about to say is that we're going into our new business, but the others of you who can't stay for a couple of minutes, Odette, can you give us, she's very important to this whole issue of health and environment. Can you give us a brief overview on your New York technology and its impact, just so this group of persons with medical interests, some of them doctors will hear, but very brief to let us know what you're doing.
Absolutely. I'm not online here on my computer.
Well, you can be heard.
That can be
You
heard.
may have to sit right.
Okay, that's fine. Well, as you know, in New York City, we are now under Section 106 review of the National Historic Preservation Act. And that is allowing people to contest and oppose the 5G towers based on historical preservation review. Now, the unfortunate thing is that the Telecommunications Act does not allow any legal recourse for anybody who sustains personal injury, because as long as the telecommunications carriers are operating within the FCC emission limits for human exposure, and they're shielded from liability. So you could be injured, and it doesn't matter, they can still come in and put in the towers. So right now, we are also I'm also heading up the National Call for Safe Technology, where Congress is introducing a huge number of bills to take away.
Can you speak up, because it's like about 20 people online. Speak up a little bit.
Okay, so there are about, last year, there were about over 70 telecom bills that were introduced to take away all local control. And what they did is they looked at every single success that people had all around the country, including New York. And what they did is they made sure that that was prohibited. So for instance, in New York City, we've had about 17 disapprovals or moratoria against the 5G towers. There was a bill, the worst of the worst bill last year, which actually specifically prohibited moratorium. So they took the success that we had in New York City and they prohibited it in a federal bill. So what they're doing now is they're reintroducing these bills because the bills died in the previous Congress. So now they have to reintroduce them. And we are trying to meet with as many federal legislators as possible. I am sorry to tell you that the congressional delegation from New York is voting for the telecom bills. Practically every single one. So we have to get to Espaillat. I have a team that will talk about the federal bills. We're experts on the federal bills, and the constituents talk about the local issues. We need to meet with Espaillat. We need to meet with the entire New York delegation under the auspices of the National Call for Safe Technology. We have an analyst, we have a lobbyist, a professional lobbyist, and then there's me, and we go and talk about the federal bills. So,
Who's the lead of the New York congressional delegation?
I'm sorry?
Who is the lead delegate with the New York with the New York group?
Nadler is the dean of the New York delegation.
Okay, he just sent something out today, so I'm not sure what that was. I have to read it.
Nadler is the dean. And we've gotten positive responses from him, but they're not responsive. They haven't been responsive in the past several months. So we need to get everybody in New York, Ocasio, Espaillat, everybody, Jeffries, especially Jeffries. We need to get to everybody because they're all voting for the telecom bills.
And when does that vote take place?
Well, they already voted and they put out a very bad bill last year. It just rolls, and it comes very, very quickly because they will vote on something within a day or two. And so we have to have already spoken to all of our New York delegation to tell them, to warn them that there's a problem.
Do you have something that states pros, cons, what the the position?
No, we don't
of
do
it?
pros, cons.
Well, that's just my way,
We tell them-
something that gives us
But
a
our
synopsis.
presentation is geared towards their committee memberships and why they should care about these particular bills, because there's a lot of bills that are coming in right now. So they're not gonna be interested in all the bills, they're gonna be interested in the bills that they are responsible for in their committee. So that is how we gear our presentations. But the problem is that we just don't have anybody in New York doing that. And I send out weekly notices about
do.
federal bills meetings, and nobody comes from New York. Everybody comes from the rest of the country, but not New York. And I'm sorry to say, they have been voting against our interests.
I'm not surprised. So we can talk again offline. Well, this will be once everyone's off, but I wanted them to hear you. Can you drop something in the chat in terms of how people can contact you, what your group does? You spoke about it, but where they can
For the
click on and
national call.
see.
A national call, yeah.
Mhm.
Well, I don't have access to the chat here,
Oh, that's-
so,
You can
I-
write it down and someone else can put it in the
but yeah,
chat.
I'd be happy to.
Okay, Odette Wilkins. All right, for the overall group, our general partners. Feel free to leave at this point. Our members will stay just to say how we're gonna handle the new business letters of support. But thank you so much, and you will be hearing from us, okay? If someone can get all the names of attendees that were online, were you able to, Heather? Because there might be a couple of new people as well. Okay. Are there any questions though for those of you who remain on Zoom? Did I miss anyone who may have had their hand up? Uh-huh.
What's the organization and when is this meeting that she talks about that nobody comes to?
Oh, hi, Ewan.
Hi.
Odette she is gonna drop it in the chat, but she,
Mhm.
the name of the organization again, because I know I get it, Odette, but I don't want to mess it up. It's
It's
New
the
York,
National Call for Safe Technology, that's the
the
one. that's
National
federal.
Call for Safe Technology.
That's the
Mhm.
federal part, but,
Okay.
but I head up the New York City Alliance for Safe Technology.
The New York City Alliance for Safe Technology.
Mhm.
And you're in touch with We Act as well, right?
With,
We Act, if not, then yeah, you should be.
Yeah, I haven't been in touch with them.
Okay, I think we
Okay.
could work together. Okay. All right, no other questions. Thank you all for joining in, and feel free to leave. Thank you again. Everyone, right before we conclude,
Yeah.
the letters of support, what we can do is, as we've done before, I'll email the letters of support and get your feedback after several days. Let's see, Deborah's still there. Deborah, is there a date or deadline that you're working toward? How rushed does this it doesn't have to be rushed.
It
Or
has to
does
be yeah, it's got to be in before the third week in March.
Oh, we're already.
Because we're in budget season. Yeah.
Okay, so our executive committee meets next week. Let's see, this is the 6th. I think that's the 13th. So that would mean that March 20th would be our general board meeting. So I guess I would get this to everyone so that by Monday next week, you can give me your feedback. Committee, as I said, we don't have a quorum tonight. This is our very first time not having a quorum. So in 3 years. But at any rate, so I thought someone was saying something to me. So we will be able to get into our executive committee next week, which we would have to have it to them by Wednesday. So hopefully we'll have it voted on changes could be, a few changes could still be made if you have them, Deborah, after that.
Yeah.
Before the general board, so.
Yeah,
we'll let-
not a problem. You can edit accordingly, not a problem.
Mhm. Okay,
And just let me know what you need.
all right. So what time is it?
8:37.
It's 8:37. Can I have a motion to adjourn? Did I hear you, Heather?
Yeah.
And then a second, Liz? You second to the adjourn?
I don't think we have a quorum. Can we vote on that?
Well, I mean, it's not, at least we can adjourn. So at 8:37, we are adjourned. Thank you so very much. Thank you, Edwin, for doing minutes. I hope you're still
Good
there.
night, folks.
Good night. So 8:37.
Always, Laquita.
Okay, there's Monica
It was a
too.
fantastic meeting.
Yeah, it was, let me tell you, it was good. Hi, Monica's waving. Okay, all right, bye, Chris. Okay. Oh, Julie's there. Julie was on too. Odette, Julie.
Oh, Julie Martin, no.
Yeah, she's, I see her name right there. Who's Jiaming Fang? Do you know Jiaming Fang? Okay, I don't know what organization. Okay, but this went out broadly, so he was representing someone. Okay, all right, so we can start wrapping up. Okay, that was good. The discussion was so important. So important. It was excellent. Let's see, how do I get out? Let me see. Oh, my goodness. Okay, this meeting is being translated. Okay, so let me, let me stop the recording. Let's see, where do I stop? Oh, it's up here. That's why I couldn't answer. It's up here. Let's see, where stop the recording? Pause.
But y'all let
pause
me-
it.